I think it's fair to say that there's been a lot of, again, development in screening for heart disease. So you're quite right. Heart disease is a very, very common problem. It accounts for about 1/3, for example, of global mortality. And that's partly due to the many risk factors, which we know are associated with accelerating heart problems, whether it be hypertension, high cholesterol, diabetes, a strong genetic or family history, whether people smoke. And there are other biomarkers of risk as well, which we also assess for as part of our workup. And so it's fair to say that, these screening tools have also advanced in recent years with the use of CT scanning, which is a non-invasive way of looking at the coronary arteries. So we are able to identify heart disease much earlier on than we used to, and hence therefore make recommendations to try and either by using drugs or simply by lifestyle recommendations to reduce the risk of that heart disease progressing. And I think early identification of disease is becoming more accepted and more routinely practiced today than it ever was. Now, many years ago, heart disease, and it still does to some degree, but many years ago, more commonly than today, heart disease used to present in its very late stages. So when you have heart disease and you get symptoms such as chest pain, breathing difficulty, palpitations, for example, and awareness that your heart is beating fast, often that's at the very late stages of heart disease, and then it's too late. I mean, the horse is already bolted, and then you're treating the problem when it's already caused symptoms. So the emphasis today is on identifying heart disease before it becomes a problem and before it causes symptoms. And as you very well know, one of the terrifying statistics with heart disease is that it can cause heart attacks, which can be fatal as its first presentation. So part of my practice is to raise education, raise awareness of risk, and then also put people through a series of screening tests, which allows us as general cardiologists to identify disease and implement changes before they potentially become a symptom and a problem to that person. So when it comes to the screening tests, one of the more recent ones I mentioned earlier is the CT scan, and that does involve the injection of dye. It's done in a radiology suite where by the placement of a small cannula, a small needle into the vein, we inject a contrast which is visible by X-ray, and the CT scan takes multiple slices of the heart and generates very, very high resolution, very detailed pictures of the heart chambers, the heart muscle, the heart valves, but importantly, the arteries. And we can see whether there are any evidence of blockages, whether they be severe or whether they be early disease, the location of the blockages. And that can sometimes be a prelude to doing a traditional coronary angiogram and, if necessary, treating with coronary angioplasty, which is, the medical term for stenting.